Welcome to CBC Part 6. In this lesson, we will explore eosinophils, one of the 5 major types of white blood cells found in peripheral blood. Eosinophils are granulocytes that play important roles in defense against certain parasites and in allergic and inflammatory reactions. Let's take a closer look at their morphology, development, functions, laboratory identification, and clinical significance. Under the microscope, a normal eosinophil is usually about 12 to 17 micrometers in diameter. Its nucleus is typically bilobed, with 2 lobes connected by a thin strand of chromatin. The cytoplasm contains numerous large specific granules that stain a characteristic orange-red to reddish-pink color. This distinctive combination of a bilobed nucleus and prominent orange-red granules makes eosinophils relatively easy to recognize on a well-prepared peripheral blood smear. Eosinophils are produced in the bone marrow through a process called eosinopoiesis. They develop from hematopoietic stem cells through myeloid progenitor cells and progressively differentiate into eosinophil precursors and finally mature eosinophils. The cytokine interleukin-5, or IL-5, plays an important role in eosinophil differentiation, maturation, and survival. After maturation, eosinophils enter the bloodstream and can migrate into tissues where they participate in immune and inflammatory responses. One important function of eosinophils is participation in immune responses against certain parasites, particularly tissue-invasive helminths. When eosinophils are recruited to the site of infection, they can interact with antibody-coated parasites and release toxic granule proteins. Increased eosinophils may be seen in some parasitic infections, especially those involving tissue migration by helminths. Eosinophils also have an important role in allergic inflammation. In conditions such as asthma and allergic rhinitis, eosinophils can be recruited to affected tissues. Once activated, they release inflammatory mediators and granule proteins that can contribute to tissue inflammation. This is one reason eosinophils are closely associated with allergic and inflammatory disorders. In a typical adult white blood cell differential, eosinophils account for approximately 1 to 6% of circulating white blood cells. The eosinophil percentage is useful, but the absolute eosinophil count, or AEC, provides a more direct measure of the number of eosinophils in the blood. For manual differential counting, a thin peripheral blood smear is prepared and stained using a Romanowski-type stain, such as Wright or Wright-Giemsa stain. The stain smear is examined microscopically, usually under the oil immersion objective. The laboratory professional identifies and classifies white blood cells according to their morphology. Eosinophils are recognized by their characteristic bilobed nucleus and prominent orange-red cytoplasmic granules. Modern hematology analyzers can perform automated white blood cell differential counts rapidly and consistently. Depending on the analyzer, technologies such as electrical impedance, optical light scattering, fluorescence-based measurements, or other proprietary methods may be used to classify white blood cells. Eosinophilia refers to the high eosinophil count. Causes: parasitic infections, allergic disorders, drug reactions, some skin diseases. Thank you for watching. If you found this video helpful, please subscribe to my YouTube channel for more educational videos on medical laboratory science.